oversees gas exchange between blood and external environment. Respiratory system oversees gas exchange between blood and external environment. Anatomy of respiratory system. Nose. Purify, humidify, and warms, by veins, incoming air. Cilia propel mucus to pharynx. Sinuses, lighten skull, act as resonance chamber for speech. Pharynx, throat. Muscular passageway. Tonsils, lymphatic system. Larynx, voice box. Thyroid, Adam's apple. Epiglottis, closes when swallow. Trachea, windpipe. Ciliated mucosa propel debris away from lungs. Bronchi. Subdivisions, bronchioles, branch off and enter lungs. Lungs. R lung 3 lobes, L lung 2 lobes. Pleura, surface lining. Alveoli, air sacs at terminal ends. Alveoli, site of gas exchange. Simple squamous epithelial tissue. Covered in a cobweb of pulmonary capillaries. Macrophages move in/out of alveoli. Cuboidal cells secrete surfactant. Lipid coats alveoli. Prevents alveoli collapse. Begins to function at 28 to 30 weeks during gestation. Respiration physiology. Pulmonary ventilation. Continuously refreshing the air in the lungs. External respiration. Gas exchange between blood and alveoli. Respiratory gas transport. O2 and CO2 transported via blood. Internal respiration. Gas exchange between blood and tissues, mechanics of breathing. Inspiration. Diaphragm and external intercostals muscles contracts. Size of thoracic cavity increases, lung volume increases, lung pressure decreases below atm pressure, and creates a partial vacuum. Air enters lungs. Expiration. Inspiratory muscles relax, resuming initial size. Lungs recoil, effortless. Air is exhaled, respiratory volumes and capacities. Tuberometer, measures respiratory capacities. Vital capacity. Tidal volume. Normal quiet breathing, 500 ml EA/breath. Inspiratory reserve volume. Air taken in forcibly, 2,100 to 3,200 ml over TV. Expiratory reserve volume. Air forcibly expelled, 1,200 ml. Residual volume. Air remaining in lungs that cannot be expelled, 1,200 ml. Allows gas exchange between breaths, keeps alveoli inflated. Dead space volume. Air remains in passageways and never reaches alveoli, 150 ml. Control of respiration. Neural regulation. Nerve impulses from medulla and pons. Maintain a rate of 12 to 15 breaths/minute. Other influential factors. Physical factors. Talking, coughing, exercising, increase body temp. Conscious control. Singing, swallowing, swimming. Limited/ignored if O2 levels get low or CO2 levels get too high. Emotional. Hypothalamus reflex, scared, gasp, etc. Chemical. Levels CO2 and decreased blood pH.